A stark warning from one of the nation's top medical experts, Dr. Anthony Fauci. He's director since 1984 of the National Institute of Allergy and Infectious Diseases. And Fauci was asked a simple question by the chairwoman of the House Oversight Committee about the coronavirus outbreak, which as of right now has claimed 33 American lives and infected more than 1,000 individuals in the U.S.
Is the worst yet to come, Dr. Fauci?
Yes, it is. I can say we will see more cases and things will get worse than they are right now. Bottom line, it's going to get worse.
Bottom line, it's going to get worse. The World Health Organization confirming today that this is a global pandemic. A crisis like this requires leaders who understand how to make government bureaucracies function, people who trust experts in medicine and science, credible sources of factual information, capabilities demonstrated by Dr. Fauci, and faculties that even the president's supporters at the Conservative National Review, which today assailed President Trump for not passing muster in leadership metrics, note that have been lacking in the president. And Dr. Fauci's warning that things are going to get worse is a jarring contrast to what President Trump told the public just yesterday.
We're doing a great job with it, and it will go away. Just stay calm. It will go away.
Just stay calm. It will go away, the president says. Here's Dr. Fauci.
If we are complacent and don't do really aggressive containment and mitigation, the number could go way up and be involved in many, many millions.
At every turn in this crisis, the president has publicly downplayed the crisis. Last month, he falsely promised within a couple of days the number of cases are going to, quote, be down to close to zero. Not true. Last Friday, he said he wanted to keep Americans with coronavirus stuck at sea on a cruise ship because he wanted to keep the numbers of cases low. And through it all, the president keeps noting how many Americans die each year from the common flu. He tweeted this week, quote, so last year, 37,000 Americans died from the common flu. Nothing is shut down. Life and the economy go on. At this moment, there are 546 confirmed cases of coronavirus with 22 deaths. Think about that, the president said. Well, here's what Dr. Fauci had to say about that.
I mean, people always say, well, the flu does this, the flu does that. The flu has a mortality of 0.1%.
Sure.
This has a mortality of 10 times that.
Experts believe that the novel coronavirus is not only deadlier than the flu, it could also be more easily transmissible than the common flu. States of emergency have now been declared in 19 states, and even the president's allies are finding his response inadequate, as CNN's Nick Watt now reports.
Schools, houses of worship, other large facilities now shut down within this 1 mile radius containment zone. New Rochelle, uncomfortably close to the largest city in this country.
You know you have an intense cluster, stop large gatherings where you have a large cluster of people who are infected. It's called common sense. And that's what we announced with New Rochelle.
In Washington state now, no gatherings of more than 250 people allowed across 3 counties, affecting nearly 4 million people.
These events that are prohibited are gatherings for social, recreational, spiritual, and other matters, including but not limited to community, civic, public, leisure, faith-based, or sporting events.
The governor has said that if more isn't done to slow the spread, Washington could see 250,000 cases within a few months. Life across this country is now changing. The Golden State Warriors will play to an empty arena tomorrow night. The Giants just cancelled an exhibition game. San Francisco just banned all gatherings of 1,000 plus. Kentucky's governor now recommending cancelling all church services.
I know that there's going to be some pushback on it. I wouldn't recommend it if I did not believe that it was necessary.
Symptoms and severity vary, but here's part of one patient's story.
Both my lungs are, I can't think straight. Both my lungs have fluid in my lungs.
And he's living in isolation.
I feel like I'm in a jail cell and just can't get away, you know. So hopefully I'll be out of here soon. It's very lonely. It's a lonely place to be.
Meanwhile, passengers from the Grand Princess who've been confined here in Oakland now arriving and entering quarantine on military bases. It's been a slow process. There were 21 confirmed cases on board.
It's going to be about an hour and a half before we start getting your bus unloaded. No.
And a difficult one.
I'm having a little difficulty breathing. I always suffer from shortness of breath.
Now, we're told that everyone will be off this boat by the end of the day today, although we were also told that yesterday. Now, I don't want to be alarmist, but I do want to share something that the German Chancellor said today. She says, by the way, Germany has maybe 500 or so more cases, confirmed cases right now than the US. And Angela Merkel is saying her experts believe that 60 to 70% of the German population will eventually become infected. Jake, that could be somewhere around 50 million people.
All right. Nick Watt, thank you so much. Joining me now is New Rochelle, New York City manager Chuck Strom. Chuck, thanks for joining us. A 1 mile containment zone around New Rochelle. It allows for freedom of movement, but it closes large gatherings at places such as schools or houses of worship. Let me just ask you, as a practical matter, if a person lives in the containment zone, but their child goes to school outside New Rochelle, what should they do? Are they allowed in and out?
Yes, they are allowed in and out, Jake. Thanks for having me. Students that live inside the containment zone but go to school outside of the zone are free to go to school. At the same time, those that live outside of the containment zone but their school is in it cannot go to school.
If New Rochelle is the largest cluster of coronavirus cases in the country, which it is as far as we know, should New Rochelle residents consider taking even more drastic action, such as not leaving New Rochelle or staying in homes as much as possible?
Well, we're telling people, based on the guidance we're getting from the public health professionals at the county and state level, that the vulnerable populations, particularly the senior citizens above 80 and those that have compromised health situations, that they should do their best to stay at home as much as possible. We're told that others can move about freely, and until we're told differently, we'll just follow the health guidelines that are given to us by the state and county health professionals.
How many people in New Rochelle have coronavirus as of now, as far as you know?
The numbers that we got today, that I got, were 108 people in Westchester County as a whole. 92 of those are New Rochelle, and they all seem to still be in and around that original cluster up at the synagogue up in the northern end of the city.
And so, I mean, what's the reason you think that this big cluster is in New Rochelle? Is it because somebody who had it went to Beth Israel Synagogue, I think it is, I might have the name wrong, and at a time that a lot of people were there, and that's how the infection spread?
Yeah, it was Young Israel of New Rochelle. There was a gentleman who they call the index case who had the virus. He went to 3 separate events a couple of weekends ago. One was a funeral, one was a bat mitzvah, and one was a general service. And that's a synagogue of up to about 1,000 people, men, women, and children. And that's why we think the infection, that's why we're told the infection seems to be centered in that area. Those folks have been quarantined since about a week ago and will stay that way until Saturday. And that was the effort to try to contain it as best possible from the health officials.
So CNN's Erica Hill spoke with one New Rochelle resident today who is not feeling well, does not want to be a public health threat, but cannot get any information about testing. How can the containment zone be effective if people don't know what to do if they believe they're showing symptoms? What should this person do?
What we have been told by both county and state officials is if you're feeling like you might have something similar to this disease, you should first call your personal physician and do not go to the emergency room unannounced. Then you should have your physician set up a visit for you to the emergency room. And at the emergency room, they'll take the steps necessary to protect both the workers and other people in the hospital, the healthcare professionals. And then from there, the county and state health department will be notified and testing will be scheduled. Look, I wish there was more testing available. There's supposed to be a testing center opening here soon, according to the governor, and the more testing we can get done and the quicker we can get that, the better, because you're right, people are concerned and they want to be able to see if they have this or not.
It just seems odd to me because we keep hearing from the White House that millions of testing kits are getting out there, and you are in the biggest cluster in the United States, and you're telling me that you don't have the testing kits you need.
What I'm saying is that I don't know that we have as many as we need. Obviously, the city is not doing the testing ourselves, so I'm really depending on the state and the county. But I don't think there's been any secret to the fact that there haven't been enough testing kits for some time now. And I think most of the testing that's been done here in New Rochelle has been done on the people in this synagogue that had contact with the index patients. So obviously, with a cluster like this and with New Rochelle being sort of the epicenter of the virus, and not only the state, but maybe outside of Washington, the country, we'd like to see as many testing kits and as much testing as available. And it's very frustrating for us to answer phone calls from constituents asking the same questions you're asking us and really not being able to tell them that there's testing readily available for them and just to go here and get tested.